Hello, everybody. Welcome to the Mouthy Money podcast. I am joined, as ever, by my good colleague and co-host, Chris Tuite, who is head of consumer finance at communications consultancy MRM. Chris, good morning. Hello.
Hi Ed, how's it going?
Yeah, no, good. Sunny day, warm. It's about 25 degrees in my office already, which bodes well for the rest of the day. Going for a walk in the sunshine and that kind of thing. Good for my health, I think, is the right way to describe it. How about you?
Heat wave incoming, are you prepared?
Always in the southwest, we're always ready for a bit of sunshine down here. I
The
think that's a
sunny
good thing.
southwest. We got the paddling pool up in the garden for my daughter who dipped her toe in and said the water's too cold. So now I just have a huge paddling pool with flies in it. So started off very, very well yesterday, I think. Hoping to continue in that vein. Anyway, enough of my personal
On that
problems.
on the theme of health and health consciousness, we have something we've actually never talked about on Mouthy Money before, and I can say that with confidence. We are going to look at the topic of health insurance today. Now, Chris, we are joined by Dr. Katie Tryon, who is Chief Commercial Director at health and life insurance business Vitality. Katie, welcome to the podcast.
Thanks so much for having me. Very excited to be here.
Katie, you're joining us today mainly because Vitality, probably one of the better, if not best known providers of health insurance in the UK. I think it would be fair to say that if you were to ask a sort of an average person in the street, can you name a health insurance provider? There's a fair bet that they might be able to say Vitality. Would you say that's potentially a fair assessment?
Well, I would definitely hope so. I think probably if anyone's been to the cricket any time recently, then definitely they will. And I certainly know from my children's perspective that they all know about the Dachshund dog called Stanley that appears frequently in various Vitality ads. So as long as they also know that we're a health insurer and not just anything to do with the Dachshund dog, that would be excellent.
Think that's about right, actually, the Daxon, definitely. Now, so we've got you here today because we really want to understand a bit better what health insurance is, why people might want or need it, and kind of some of the costs and things to think about with it as a kind of a tool that people use as a part of their wider kind of financial lives and lives in general. I guess it goes beyond just finances, a product like health insurance. Before we really dig into that topic, though, just tell us a bit about yourself. Just tell us a bit about your background and anything else about Vitality you think's worth mentioning.
Yeah, I mean, I can talk briefly about my background. So I trained as a medical doctor many, many moons ago, and really left frontline medicine because of becoming very interested in the finance of healthcare, of how do we afford healthcare for everybody as everyone's getting older and sicker and healthcare is getting more expensive. So that's really why I left frontline medicine and ended up through a kind of circuitous route coming and working for Vitality. I've worked in multiple different countries, whether that's the UK, the US, and I've spent a significant amount of time in Africa. And I can tell you, all of these countries have the same challenges when it comes to healthcare financing. And I guess that really boils down to where I think Vitality is interesting. So, for the last 30 years, the group as a whole has been not just investing in, ensuring that people have great healthcare coverage, and we can talk a bit later about what that means in terms of actually paying for your healthcare in a hospital, but actually really investing up front in that question of how can you encourage people to change their behavior and invest in their health and well-being for the obvious benefits, we call it shared value, for the obvious benefits for us as an insurer, but for benefits to the individual as well as society. So we've really built up this model that's become very familiar in the market around helping people to understand their health, make it easier to get healthier, and then actually really actively reward people for doing that. And I think that's what we should dig into a little bit when we talk about how the healthcare market and private medical insurance has evolved from 30 years ago, where it was paying for hips and knees in hospitals, to a much more holistic proposition now. And I think we're really moving on a rapid journey in that direction.
So I think this is what's really, and this is the thing where in the UK there's quite a specific discussion to be had here because so much of health in the UK as it exists is done by the NHS, and health insurance is one of the alternatives. But then in the middle, you've got this kind of out of pocket, which people end up spending on healthcare. And that's something that, while it's quite difficult to come by kind of reliable figures on that, is supposedly beginning to rise, where people are finding that obviously the NHS performs a really core function in a lot of different ways, but actually alternatives are now becoming more popular. But and we're not going to have a discussion on things like how the NHS functions and how we fund it today. That's not for today's discussion, because it's probably an entire series of podcasts in and of itself. But people find, as they want more direct, quicker access to things like GPs and that kind of thing, that they are, going down that route of just paying, for that kind of appointment. So this is where health insurance can provide that kind of alternative. Now, let's just understand a bit better. So, when it comes down to what is health insurance, what are the kind of things that it covers, and what sort of difference is it providing to that kind of nationalized system that we have in place that everybody's so familiar with?
Yeah. Well, let me talk first about traditional health insurance. So, in terms of what does it cover, it covers, depending on terms and conditions within policies, but it covers the healthcare needs that you might have within a private environment. So that might be, musculoskeletal issues is one of the big kind of reasons that people use their health insurance, cancer claims, cardiovascular claims, and those would be the sort of really big ticket items that people have always historically and traditionally bought health insurance for. I think one thing that you've really touched on there is actually, if we start moving upstream a little bit, where the real growth in the offering of health insurance has been in primary care services, in addition to that. So, we were one of the first to launch a GP service back in 2015, but actually that area of what we call everyday care, others call primary care, has grown at a rate of knots, and this is hundreds of % in terms of growth, in terms of those claims. So that might be GP services, that might be physiotherapy services, talking therapy services. We have skin analytics services. Those sorts of offerings are really increasing when it comes to coverage in health insurance. And then I'm just going to move upstream one more step, which is on that kind of health improvement and prevention side of things. And that's really a growing area for people being interested in helping them to manage their health. So that may be around, famously, we obviously spend a lot of time investing in people doing more physical activity and monitoring and measuring and rewarding that based on their Apple Watches. I'm wearing one today, or their devices, but also thinking through, how can we help people improve their nutrition, stop smoking, lose weight, and do kind of necessary screens as well. So I think there's been a real evolutionary step with health insurance, and we've really led the charge on that, to say it's no longer just what I would call those really big ticket item claims that I started with, but actually now there's a much bigger breadth in terms of what health insurance covers, and I would say is focused on helping you to manage your health, as opposed to essentially paying the bills downstream.
Katie, can I just jump in on that? It's a really interesting point. So I'm interested around the drivers of that, because obviously, look, Ed mentioned we're not going to go into the whys or wherefores of the NHS, and nor should we, and putting it out there, I think everyone's a fan of it, right? That it exists and that it does what it does. But I'm interested in the driver of that change in behaviour, the offering of those kind of, I suppose, like gateway services. Do you think that's been driven by the fact that we are more increasingly health conscious as a populace, driven by the Fitbit revolution, more exercise conscious, more aware of our resting heart rates and all that kind of good stuff, and therefore health has become more of an active journey for all of us because we've got the data, whether it be on Strava or whatever? And how much of that do you think is a sense that so people are kind of taking charge of their health and being more proactive with it? And then how much of that interacts with the fact that actually we do know that frontline services have been struggling a little bit for quite some time? We've had the age of austerity, we've had kind of cutbacks, and people are less willing to sort of wait for what they see as really kind of important things because they're more health conscious. What's the balance there, do you think? Do you think it's the frustration or it's the proactivity that's driving that?
I think there are so many elements to it, but let me bite them off probably in reverse order. I mean, we've done research to absolutely show that things like our claims are directly correlated, even at a local level, with waiting lists and
Right.
some of those challenges. So there is, there's good evidence to show, obviously, that we have a very symbiotic relationship with the public sector, and that has definitely, that's definitely played out in the data. And I would say, certainly, if you think about those three buckets, certainly in that kind of secondary care hospital things, like I say, the direct correlation with waiting lists, certainly in primary care, access to services within primary care, and actually some of those health improvement and prevention services have always been something that, have public sectors has struggled with for obvious reasons. And like you say, we won't dive into this in the podcast, but we've all had many conversations in other environments around what some of the real financial and economic challenges are for the public sector to be able to engage in that. So I would say that is definitely a tranche, and that definitely pays into it. I don't know, please don't ask me a weighted percentage on these things, but,
No, it's good.
absolutely that plays into it. I do think this whole concept of quantified self plays into it. And, I think we're really on a journey in that quantified self, which says, everyone became completely obsessed with data and quantifying data, but not necessarily knowing what to do with that and how to action upon it. And I think looking increasingly for guidance to navigate that quantified self experience, I think is a really big driver in how organizations like us have a role in helping people to kind of navigate that environment. And then I would say that there's a sort of third part, which is to do with both the healthcare system as well as people's awareness of it, which is around that early intervention kind of concept. And I think increasingly people are aware that early intervention makes a big difference. And that's not just from the finances of systems know that it costs less to intervene earlier, but actually also just from an experience perspective, it is better if you can do physio rather than having a hip replacement, for example. So those sorts of early intervention. But you need to match that with the ability and, a healthcare system that can support that. And the healthcare system has been on that journey, I would say, both in the public and the private sector, to start thinking through actually, how can we intervene earlier? How can we intervene in inverted commas closer to home, i.e. without, outside a hospital environment? And so I think kind of matching those pieces together would be the kind of big tranche, I would say, that's played through this. As I say, I couldn't tell you the weighting. I'm going to say a third, but there's only because I don't have a better idea. But I think all of these dynamics are playing in. And then I think probably one of the very big things that I should have talked about, of course, is the whole technology revolution that's happened in healthcare. And we were on a technology journey anyway, in terms of kind of virtual access to services and the way in which we're structuring services. Obviously, COVID rapidly escalated the pace of change and the pace of adoption of that. And so we kind of came out of the COVID era, I would say 10 steps ahead of where we would have done otherwise, despite being on that journey already. But that's facilitated a lot of this change in that third section of how can we better manage care, closer to home within a kind of more community environment. And really that digital revolution, I think, has enabled a lot of that shift, and that escalated hugely in the last 5 years.
I mentioned a little bit earlier. I mean, obviously, vitality has very much a focus on the preventative side of things. So, using things like the Apple Watch and all that kind of data-driven thing to help people kind of make choices that means they don't need the insurance in the first place. Obviously, that's kind of good for the customer, good for you, because it means that you're not having to pay for conditions when people get them, because people are staying healthier, and people are staying healthier, and that's kind of a good thing. With that in mind, what do you have a typical kind of customer, or do you see a variety? Anything from kind of young people who are kind of staying ahead of it to sort of older people who want to make sure that they don't, drift towards ill health. Is there a profile there that you've got, or does it vary?
So we get a huge range of customers, because, whilst obviously having this huge kind of program in place around incentivized behavior change, a lot of people buy our product because they just want really good health insurance, in terms of just the sort of secondary care piece. So in terms of people's motivation for getting fitter and healthier, we actually, I would say, see the kind of full spectrum of that. But what our real motivation is to try and say, wherever you are on that journey, we want to meet you and encourage you to change, whether that is by age, like you say, if you're 20, it's different to what you're going to do if you're 60, or whether that is by fitness level, right? It's very different for a marathon runner versus someone who doesn't actually do exercise on a frequent basis. And so we really tried to structure the program, and we've done a lot of research recently. We published some stuff last year called the Habit Index, which was very much around this sort of thing, which is to say, whatever age and stage you are, how do you form healthy habits? And really focusing on that idea of, we're not basically telling everyone to go out and run a marathon tomorrow, right? Every kind of in the classic strapline, every little counts, right? But trying to get everyone to think about what is that small delta of improvement that they could make that has a significant benefit down the line. And that delta can be from whichever baseline, like I say, whichever baseline on age, whichever baseline on health, whichever baseline on fitness. There's always a delta of improvement that could be made on both your physical and your mental well-being. And so that's really how we think about it, as opposed to in absolute values, who have we got and where do we want to get them to? It's all about the change. And I think in terms of, the thing that we've really over-indexed on is also around this reward function. So you say that it's good for us as an insurer. Of course, it's good for us as an insurer, right? The fitter and healthier you are, the better it is for us as an insurer. And of course, it's great for the individual because they're going to feel better. We talk about lifespan and health span, but I can tell you, to a 20-year-old, that is really far away. When people start saying things like, if you do this every day for the next 50 years, you're going to be able to play with your grandchildren. I mean, I don't know a 20-year-old that actually that resonates with. So what we are really trying to do is say, we'll bring that reward closer to you, and people can get a significant amount of their premiums just in raw financial sense back from really optimizing on the rewards they can get through the program. So, there's something kind of wonderful and kind of ambitious about saying that everyone cares about their health and well-being. Not everyone does, but actually money talks. I mean, you've got a great name for your podcast. Money talks. And if you're really tangibly rewarding people on a weekly, monthly, annual basis, they actually do start going down that journey of health improvement. And like I say, sort of start thinking about that delta.
That journey isn't linear either in some ways. Sorry to cut across it, but I'm quite interested in this quantified self because I've sat here thinking I have always been interested in health and fitness. I've got 2 young kids now, busy life and lots of other pressures, squeezed middle in terms of aging parents and all that kind of good stuff. So less time. And yet I have numbers in my head that I know were right for me 3 years ago that I need to kind of consider: number of calories I need to eat in order to lose weight, number of workouts I should be doing, how much I should be deadlifting, all this kind of weird sort of data bouncing around in my head. And I'll be honest, recently I found it all quite debilitating. I found it a bit kind of off-putting. It's just like actually having to constantly reach these numbers is quite difficult. And demotivating. It feels like you're kind of running on a treadmill rather than kind of making progress. And that's where I think the rewards thing's quite interesting, because I'm now sort of battling in this way of kind of reframing those conversations. What does that look like? It is, I want to spend longer playing with my kids. I want to be able to run around in the park, which I can, but I want to continue doing that until my 70s, ideally, hopefully my 80s, 90s, who knows. So I think, finding different ways to reframe that conversation and to give people accurate kind of information and guidance around it can only be a good thing. And if that then pays off in the financial sense, which I'm also becoming more aware of, as we've discussed on this podcast, Ed, I think it gives that extra push just to do the right thing and maybe reframe it in a way that gets you more motivated. So I'm quite interested in how the numbers and the data stacks up with the lived experience. And it seems like the rewards program is quite an ingenious way of doing that.
So absolutely. I would also say, the rewards is key, but I also think one thing that you've picked up on there is the noise. So I find it amazing nowadays that, because everyone's got devices, the amount, I was talking to a cardiologist friend of mine the other day about this, about how people know about heart rate variability, right? I mean, people know an insane amount about heart rate variability, and yet the average 40-year-old hasn't done their standard check of blood pressure, blood glucose, blood cholesterol, BMI, right? I mean, that's what we do, a health check. We offer everyone every year to go through a health check, right? Really important. And I find sometimes that, like you say, there's an insane amount of data in some areas that people don't really know what to do with. And then some of the just really core basics that you should all do. And, there are some very direct actions you should take off the back of things people aren't doing. And I think one of the things that we've really tried to do is kind of cut through the noise a bit. So we launched something a few years ago called Next Best Action. And I know it sounds incredibly simple and almost trite, but actually it's just to say there are a million things you could do to improve your health. Absolutely. But, why don't you just do this one thing tomorrow? And I think people really appreciate the kind of the clarity and how succinct that is. And then once you've done that, we say, okay, right, now do this. And then now do that. Because I think with access to information, with access to data, with access to devices, we're overwhelming the system a little bit. And I think, like you say, you can feel that sort of lost in the system sense in a quantified self environment.
I think bringing it back to the kind of why this matters in a kind of financial sense, and whether it actually can help people's finances. I think it does speak more to this element, what Chris alluded to there, where like when you're a breadwinner in a family, you and your partner might earn similar amounts, but without your income, you'd really struggle. Obviously, we have policies like income protection and that kind of thing do exist, and they are kind of a measure which can protect people's incomes, but actually the health insurance also works towards that in keeping you healthy to ensure that you can go to work and you can have the lifestyle that you want and that kind of thing. So that, for me, that feels like the financial, I could call it incentives, but not quite the right word, but the reasoning why you might use a policy on the finance side of things is actually because if you had to go without your income suddenly, it would be a big problem. So making sure you protect your ability to work by having something like health insurance is really valuable, especially given the uncertainty that we sometimes have now around kind of the national systems in place. Is that fair?
That's absolutely right. Again, I would sort of almost break it up into the three sections that I alluded to earlier. I mean, in the sense that, having that health protection around, let's say, your secondary care needs, is really important if you are living with either either an unhealthy situation with something that needs to be addressed, or uncertainty as well. You think about things like speed to diagnosis and, access to diagnostic services, I think is really important to help you get back into the workplace, and get whatever it is that you need managed in a kind of quick, safe, and effective environment. So I think that's really key. Then you talk about primary care, and I think it's very, very similar there, right? We know that the sooner you get care, the sooner you get directed in the correct direction, the better. So, rapid access to these services is really important around keeping people within the workplace, and also having that give in the system in terms of, I think about our virtual GP service. Actually being able to access a virtual GP service during the day when you're busy working is really, really important. And that can really, really speed things up. I mean, Chris, you alluded to your children. I've got 3 small children, and, I actually just don't have time to be able to be constantly stopping, going to GP appointments, sorting various different things out. Actually being able to kind of access a rapid GP service is really important to me. So I think that those parts. And then the other parts are some of the work. I mean, some of the work that if people that are really interested in this might want to dig into. We've been running for the last 10 years, Britain's Healthiest Workplace, and thinking about some of that prevention stuff that we talked about. And what does that mean in terms of, productivity at work? And, devastatingly over the last 10 years, our productivity has plummeted, right? In terms of, we were seeing average lost days have doubled over the last 10 years. They're now at 50 days on average per employee per year, right? I mean, that's 20% of your wage bill gone there. And a lot of that linked to health and well-being. So we have something called the vitality age. If your vitality age is old, it means your health age is older than your actual age. If it's small or negative, it means that you're sort of healthier than your actual age. And just to put it in context, if your vitality age is 7 years or more, you're likely to lose 82 days a year. If your vitality age is less than is -2, you're likely to lose more like 30 days a year. So just productivity in the workplace. And that is linked to both physical and mental well-being. So physical activity, obesity, mental well-being, smoking, etc. So actually thinking through your health and well-being, not just in terms of can I get rapid access to care when I need it, but is somebody helping me to invest in my health and well-being, not only because it'll stop me needing that rapid access to care, but actually also just in of itself, it helps me with my productivity kind of at work. And I think that's just really important context to think about in this environment.
It's, thinking about now in terms of how people access it, and where they're going to tend to get it from. I know a lot of people get policies through workplaces. That's very common. So you'll get it as when you join a company, there'll be like a group policy. So just is that where Vitality kind of does get most people kind of gain exposure to these health insurance products, obviously, and can people just do it themselves? And then, sorry, this is about turning into about three different parts of this question.
That's okay. I
What are
might
the
not remember all parts, but I'll try.
let's see how we get on. And then interested in the terms of the cost. I know that it's quite a difficult question, but what sort of cost can people anticipate?
Okay, let me bite that off in order. In terms of where people access their health insurance, you're right. The majority, the majority, but not all of our policies are through workplaces. But often when people think about workplaces, they're thinking about really big companies. And we have a number of really big companies, but also we're talking about, sort of 4, 5 to 10 employees. So actually relatively what I would call very small groups also are heavily invested in health insurance, and you can often access, and often it's good if you are in a kind of small business environment rather than each individual applying individually for health insurance, to actually kind of apply as a single entity. So that's definitely worth looking into. But 20 to 30% of health insurance is individuals or families, and that's a perfectly straightforward route to apply for. So there's definitely a product for everyone out there, I would say. In terms of cost, like you say, it's incredibly hard. I mean, at an individual level, it depends on the benefits that are within them. If I'm completely honest, you can go anywhere from £70 a month to a couple of £100 a month, in terms of what the benefits you're looking for, excesses applying, extensiveness of those benefits, etc. So it's pretty hard to put a specific number on it, but those would be the ranges, I would say, that you would potentially give for
Yeah.
it.
So for someone, I mean, someone who wants to look into it now, what would the process be? Say they get in touch with Vitality. Do you speak to is it an advisor you speak to, or how does that work? In terms of getting it.
Yeah, absolutely. I mean, there's direct, so you can apply online. There's advised, so you can go through an advisor. So there are a number of different, you can call up, you can go online. There are a number of different ways to do it. So, I would recommend anyone who's looking at an individual level or even a business level goes online, finds us online, and goes from there. But it's a very straightforward way of going through the process.
And presumably, you guys will take into account previous medical history, age, all that kind of thing, because there's a calculation that needs to be done in terms of the likelihood of you guys having to pay out, right? So how extensive is that? And obviously, the more you're able to do that, will that reduce the cost of the premium?
Yeah, so there are a couple of things to sort of bear in mind with health insurance. I mean, one, definitely age, and that's why that range I gave earlier is so large. In terms of a 20-year-old applying is very different to a 60, 70-year-old applying. So age definitely takes into account. There are different forms of underwriting for for people coming in. So you can have full medical underwriting. For kind of businesses, you can have medical history being disregarded depending on how many people are on the policy. You can have moratorium underwriting, so that you just have a moratorium for a period of time. There are different ways, and obviously those have different prices attached to them in terms of how those are underwritten, and in terms of your previous medical history and what would and wouldn't be accounted for in that. And so, yeah, it's worth digging into that either in an advised way or online, and just understanding what the different limitations might be and what the different costs associated would be.
And the claims process is relatively straightforward. Is
Yeah.
that fair to say?
So I
Yeah.
think there are a couple of things that are worth noting on the claims process. I mean, one is now that we have over 50% of our claims are just purely digital. Sort of very easy. We've got something called Care Hub that's, a hub online, and you go through a claims process without even, having to kind of interact. Where it comes to more complex claims and where people potentially need a little bit more help, particularly things like cancer claims, complex cardiac claims, we actually have a specialist team to help lead you through that. It's a very, very sensitive time in your life, and we think that extra support is really, really important. But for the straightforward claims, it's very straightforward to be doing it online. The other really big change that's been made across the industry is historically to get to do a claim in private medical insurance, you always had to go to your NHS GP and then get a referral. Whereas now we've got something called integrated primary care, where you can go to the Vitality GP online and then go straight through if it's appropriate, if that's what if that's the most appropriate direction for travel. You can go straight through and get approved, kind of from an end-to-end perspective. So things have changed a little bit in the market there.
And just on yeah, definitely. I mean, I've experienced that myself, having to go through the NHS GP route, and as we all know, access to NHS GPs is at a bit of a premium at the moment, so that can delay the process. But on that, I just wanted to touch on that briefly in terms of the medical teams involved. So you mentioned you've got specialist Vitality GPs. Are they full time on the private side? Do they work in the NHS? Is it a hybrid? What's the sort of medical expertise that you're accessing when you make one of these claims, if you see what I mean?
Yeah, so what I would say is there's a slight difference in terms of our medical teams in-house who are helping navigate claims. So, there is definitely, there's definitely a role that we have within the business to help people navigate their claims journey. Where it comes to things like our Vitality GP service, that's actually provided by our partner Livy, who then have employed and locum GPs that are potentially working private and public, like you say, and then and they are then being kind of managed within a clinical governance structure that is within that GP service. That is not within Vitality. We kind of contract with them for the provision of that service in a very similar way to, we don't own our hospitals and we don't own our consultants. We contract with them to provide that service for our members. So there is a slight nuance there.
Makes sense. Yeah.
But
Do you feel like this is...
Sorry, I would just add that,
Yeah.
we do make sure that the GPs on the Livy side, like you say, because we have this symbiotic relationship with the public sector, we make sure that there's access both ways, in terms of, obviously, the kind of information is traveling both ways between those two environments, so that the Vitality GPs understand, what the background information might be from the public sector, and that, from someone's personal GP, and that anything that they do within the Vitality environment then also goes back to their NHS or personal GP, because that's obviously key, where you have this kind of symbiotic relationship between the two environments.
Yep.
Great. I mean, my last question was actually going to be for Chris. We're asking whether this is making him consider health insurance as an idea for him in his family at this point.
I've already got it through as an employee benefit, which is great. My experience of it is quite interesting in that the 24-hour GP thing has come in incredibly useful. So when I've been on holiday in the past with my daughters, my eldest daughter in particular, she got ill when we were quite a long way away from home, and it was incredibly reassuring to have a conversation with somebody set at a time zone that we could go on and have a conversation with them and put our minds at rest, because all sorts of things are kind of running through your head about what that could be. So I found that to be incredibly helpful. I've definitely that was far easier to access for me. And I'm with another provider, not Vitality, I will say, but it was far easier to access a few years ago. And I sense that's maybe the popularity point you made, Katie, where I think actually more of those slots are getting filled up as more people are aware of them. The other thing was I had some musculoskeletal issues, which I won't go into in a huge amount of detail, a bit of kind of mix of sporting injury and getting older, I suppose. which again was dealt with really promptly and really helpfully because it was quite debilitating. It was impacting my ability to work. To your point, Ed, I wasn't able to come into the office at certain points because of all sorts of sort of aches, pains, and joint issues and all that kind of good stuff. So I found it very useful for those things where you'd have to wait a hell of a long time to get those sorted out. And what I also found on a practical level, without talking too sort of obtusely, was that that really helped my mental health because not being able to function at 100% has a grinding effect on you at times, and just getting on the train or not being able to cycle into work, which I like to do, and things like that really kind of has an impact. So that speed and the efficiency with which that was dealt with was something I found really, really, really useful. And being able to access those services, touch wood, I haven't had to do it for any of the other, bigger things you talked about there in terms of cardiac stuff and cancer stuff and all that kind of good thing. And the feedback I hear from, friends and family members who have had to deal with that is that, NHS services have stepped up well for them there on that kind of thing. So it's reassuring to have both, I suppose, Ed, and, understand that if it's not being prioritised by the kind of public side of things, then there is that option for me to go into that private way. And I feel very kind of lucky and privileged to be able to do that, to fix those problems. So in answer to your question, I'm pleased I have it. Does that answer it?
Yeah, it does answer. I didn't know. Wasn't aware that you had it, and that it was even an employee benefit. So there we
Well, I
are.
said someone's getting an email after this, listeners.
HR, fine. Yeah, no, I mean, I kind of share that. I think, well, it's funny because you go through different cycles of how you interact with things like the NHS through your life, don't you? I mean, obviously you have the experience of as a child, and then I mean, I went through the experience with my mum and my dad as well at various different points in their lives, and then having young kids and that kind of thing. And actually, the hospital system for that has always been fantastic. The thing that we find so difficult where we are in Devon is access to the prime, like you said earlier, Katie, that primary care service is a real issue for us. The GP's okay, you know, not great, could be better kind of thing. And actually, the thing that I find most interesting is when I try to speak to the GP about something, I usually have quite a hard time getting them on the phone. When my wife gets in touch with them on behalf of my son, who's 18 or 19 months, usually they deal with it very quickly. So there's a different kind of qualitative service there, depending on who you are, which I find obviously, children are more, are more vulnerable and that kind of thing. So that's what matters there. But the thing that we really struggle with where we are is pharmacies and dentists. We don't have a dentist where we live. There just aren't any. There's not even private dentists where we live. So we travel over an hour to get to a dentist, which is private, not even NHS. And then pharmacies, we now have an issue where the pharmacies in our town we live in are all shutting down. So we only have two serving a community of about 15,000 people. You go to the pharmacy and you queue for an hour to get a prescription, which is crazy. And that for me is really striking and concerning kind of thing. Now a dentist and pharmacy point, I don't know what if Vitality has involvement in that side of that stuff. Like dentistry possibly, but pharmacies I don't know. I don't know if that quite works the same. How does that work, Casey?
No, I mean, in the sense that we do have pharmacy agreements in terms of being able to access, should you get prescriptions from a GP service or a secondary care service, we've definitely got pharmacy agreements, but we certainly don't own any pharmacies or run any pharmacies. And similarly, we've got an optical, dental, and audiological financial product. But again, we don't own any dental surgeries or any dental facilities for the provision side of things. So, so we can definitely have geographic challenges as well for our members in some of those circumstances. Generally, we do manage to provide. We only offer if we can provide enough kind of coverage and service. But I know there are pockets of real challenge.
Just on that, Ed, actually, one of the options I had was to get the antibiotics I needed for my daughter on one occasion delivered to the house because I couldn't take her because she was too ill and my wife had to do other things. So, little things like that just grease the wheels so much easier. They make it much easier to kind of respond to this and feel like it's under control and less painful. So, yeah, little aspects of that have proven to be hugely useful.
A lot of people use our delivery service for the pharmacy. For I'm sure that reason, Ed. I'm sure that reason. Funny enough, where I live, the place is always empty. They're always so happy to see anybody, which is amazing.
Down here.
Well, I don't know. I mean, I'm in the middle of nowhere, but anyway, just lucky, I suppose.
Yeah, I don't know. I mean, the pharmacy one I think is perhaps unique to where, not necessarily unique, but the issue that we have is the big high street pharmacists who I won't name have left town, and that's created a big issue. Anyway, I mean, these are all challenges that I think people are acutely aware of, right? We all kind
Mm.
of come up against it in our daily lives now, and it is a rising problem. I think, we have a situation where the government is trying to deal with some of the issues, but whether that's going to be look at anything like a short-term solution, we don't know. But I think this is, for me, it's been really, really interesting just to understand. I think even just at a basic level, just to understand what it is and what people could do with health insurance as a product and how that factors into their kind of financial lives has been really, really valuable. So, Katie, I wouldn't say thank you for joining us and telling, just walking us through it at a basic level. Really, it's been really, really interesting.
Pleasure. Always happy to do so.
And Chris, thank you for being candid about your experiences with it as well. So I think that's really, really helpful to know.
No problem.
I think that about wraps us up. Been a really, really interesting one. We're doing more on protection in the next month or two. We've got loads of other interesting things coming up as well. So please do keep an eye out for everything on our social channels and on the website. So Katie, thank you again, and Chris, thank you too. We'll
My
see you
pleasure.
all again soon. Thank you very much, and goodbye.
Thank you for tuning into the Mouthy Money podcast. Don't forget to hit like and subscribe on all our content. Follow us for more on your preferred podcasting channel, including Spotify, YouTube, or Apple Podcasts. Stay in touch by following our social channels on Instagram, TikTok, and LinkedIn. And don't forget to subscribe to the Mouthy Money newsletter on mouthymoney.co.uk. The Mouthy Money podcast is produced for general informational purposes only. It should not be construed as investment, legal, tax, or other forms of financial advice. If in any doubt about the themes expressed, consider consulting with a regulated financial professional for your own personal situation. Past performance is no guarantee of future results. Investments can go down as well as up, and you may get back less than you started with. Never invest more than you can afford to lose. For more information, visit fca.org.uk/investsmart for more. Thank you.